This is Radiesse for cheek enhancement. Hi, this is Dr. J. Park with Cosmetic Medical Training. Today we're going to be talking about Radiesse for cheek enhancement. Cheek enhancement using Radiesse or calcium hydroxyapatite is a sophisticated procedure that requires a deep understanding of facial anatomy and the unique properties of the filler. This manual This manual will provide detailed guidelines on using Radiesse for cheek augmentation, ensuring patient safety, and maximizing aesthetic outcomes. Radiesse consists of biodegradable calcium hydroxyapatite microspheres suspended in a carboxymethyl cellulose-based carrier gel. The calcium hydroxyapatite formation includes lidocaine for improved patient comfort. These fillers provide immediate volume and stimulate collagen production, leading to long-term aesthetic correction and improved skin quality. The results can last a year or more in certain patients. The unique property of the calcium hydroxyapatite is distinguished by their high G' and viscosity, making them ideal for placement on periosteum. Radiesse is contraindicated in the following: severe allergies. It's not suitable for patients with history of anaphylaxis or multiple severe allergies. Hypersensitivities. Avoid use in patients with known hypersensitivity to any components of Radiesse, including lidocaine or amide-type anesthetics. Bleeding disorders. It is contraindicated for patients with bleeding disorders. Warnings are as follows: vascular risk. Injection into blood vessels can lead to serious complications like embolization, occlusion, ischemia, or infarction. Symptoms like vision changes, stroke sign, skin blanching, or unusual pain require immediate cessation of the injection and prompt medical intervention. Inflammation or infection. Do not use in areas with active skin inflammation or infection. Overcorrection. Avoid overfilling to prevent excessive correction. Lip use. Safety and effectiveness in the lips are not established. Nodules have been reported. Short-term reactions such as bruising, redness, swelling, lasting less than 7 days are common. Precautions are as follows: practitioner expertise. Radiesse should be used only by trained, experienced healthcare practitioners knowledgeable about injection anatomy. Familiarity with products. Practitioners should thoroughly understand Radiesse and its usage. Cannula and needle use. Specific cannula 27 gauge and needle 25 gauge types have been evaluated for safety and effectiveness. Radiopacity. Calcium hydroxyapatite particles are visible on CT scans and plain radiography. Patients should be informed of this for future medical procedures. Risk discussion. Discuss all potential risks with patients, including signs and symptoms of complications. Jaw function. Jawline injections may temporarily affect jaw function. Infection risk. Follow standard precautions to minimize infection risk. Medication interactions. Increased bruising or bleeding risk in patients on medications like aspirin or warfarin. Post-treatment procedures. Patients need to be cautious with procedures like laser treatment or chemical peeling after Radiesse injection. Long-term safety has not been established in clinical trials. In specific populations, safety during pregnancy, breastfeeding, or in patients under 18 years is not established. Keloid, hypertrophic scarring. Safety in patients prone to keloid formation or hypertrophic scarring is unknown. Safety with other dermal therapies has not been evaluated. Herpes reactivation. Potential reactivations in patients with history of herpes may occur. Drug interaction and periorbital use. No studies on interaction with other drugs or implants, and safety in the periorbital area has not been established. Sun and heat exposure. Advise patients to minimize exposure to sun or heat for 24 hours post-treatment. Aseptic technique. Ensuring an aseptic technique during the session ensures prevention of infection. Single patient use. Do not re-sterilize or use if packaging is damaged, and avoid reusing the needle. Dispose of syringes and needles as per medical and legal requirements. Assess risk-benefit for patients with congenital methemoglobinemia or those receiving methemoglobin-inducing agents. Adverse events include the following: ecchymosis, edema, erythema, granuloma, nodules, pain, pruritus, soreness, numbness, contour irregularity, tenderness, and irritation. A good patient assessment is crucial for a successful outcome. Radiesse for cheek enhancement is suitable for patients seeking enhancement of the malar eminence. It's ideal for restoring facial balance and countering the age-related bone mass loss, soft tissue atrophy, and skin laxity. A consideration for male patients is to be cautious not to feminize a male face unless that is the desired outcome. Men's faces have different contours that should be respected in the augmentation process. During the consultation, discuss the aesthetic goals, evaluate facial structure, particularly the malar area, explain the procedure, potential risk, and expected outcomes. You want to get a detailed informed consent, outlining the procedure, potential risks, and post-treatment care. You want to assess the facial symmetry, focusing on the malar eminence and the cheek area. You want to document pre-treatment photographs. For patient comfort, an infraorbital nerve block may be used, or a small amount of local anesthetic can be administered in the areas outside of the infraorbital nerve block. When injecting, you should focus on expanding the entire cheek space and not just filling any depressed areas. You want to avoid injections above the orbital rim, and you want to treat one side of the face completely before moving on to the other. You should also be mindful of the amount of fillers that's remaining in the syringe before moving on to another area and having the discussion with the patient about the number of fillers they're willing to purchase. There are two main methods of injecting this area. First is linear threading and a deep bolus injection. For linear threading, begin in the malar region, approaching from below and proceeding upwards. Use a 27 gauge 1¼ inch needle, using multiple linear threads in a fan-like motion. Cross-hatching of materials in multiple planes and depths is essential for optimal structural support. You want to extend multiple strands of the product laterally along the zygoma using the fanning technique. For depth and volume, small volumes of radius is required for each thread deposition, typically 0.05 ml per pass. Typical volume of facial contouring ranges from 1.4 to 2 ml or 0.7 to 1 ml per malar area. Massage the implanted area to eliminate any palpable filler material and achieve the desired contour. For the deep bolus technique, you want to put in precise amounts of products deep, effectively contouring the cheek area. Injection points are as such. You want to mark 3 to 6 injection points on the cheek depending on the patient's need. Draw a curved line along the malar eminence, approximately 2 centimeters below from the orbital rim, and mark 3 injection points. A second line, parallel and 1 centimeter below the first, can also be marked with 3 additional points depending on the patient's desired outcome. For the injection technique, you want to inject at a 90-degree angle to the bone, just above the periosteum. You want to inject an appropriately sized bolus below the muscle layer. After injection, Gently mold the material to create a natural contour along the face. We recommend that you start with one syringe divided between the cheeks for subtle enhancement before you use an additional ml per cheek for more volume. Distribute most of the filler over the most lateral points of the malar eminence, then towards the most medial point near the nose. Use less filler in the middle section to avoid excessive volume. The consensus recommendations are as follows. For zygoma contouring, inject less than 0.5 cc of Radiesse per side. The consensus recommendations for anteromedial cheek contouring is as followed. Use a 25 gauge or larger cannula to avoid injuring a blood vessel. Do not inject Radiesse into the infraorbital area and use only hyaluronic acid fillers. And inject up to 0.5 cc of filler per side. Aftercare, instruct the patient not to push or sleep on the injected site, as this can cause cheek filler to become flattened. Facial symmetry is a challenge to guarantee due to bruising and swelling, and patients should be warned about a possible touch-up. Cheek augmentation with Radiesse is a powerful technique for facial rejuvenation. Mastery of injection techniques through thorough understanding of facial anatomy and careful patient selection are crucial for achieving optimal results and patient satisfaction. This is Dr. J. Park with Cosmetic Medical Training. Thank you for watching. If you have any further questions or want hands-on training of Radiesse for cheek enhancement, please contact us by email or phone number. If you also want help with the business side of running your medical practice, please contact us. Thank you